have enough of the answers. That's why the governors, who again, they were first charged with responsibility in COVID for management. Let's be honest, it all was up to the governors. And they think, what do I have to now do to do this? How do I accomplish the task? And the questions that the governors are asking the White House are the questions they need answered before I can come up with that plan. I have total confidence that we can do whatever we need to do. And I believe, New York arrogance, that we can do it faster, better than anyone else, right? Or at least we'll try to. But I don't know enough to tell you I know how to specifically plan. And that's what the questions to the White House are about.
And to follow up, because remember when you had to buy PPE and you got the other states together to create a more viable marketplace.
That is exactly right.
You'd have to do that again possibly if you don't get these answers. Something like that.
Well, would there be an advantage to a multi-state collaborative, which is one of the questions to the president? You know, how does this refrigeration work? You know, does everybody have to create their own facility, or can we just have one massive facility? You know, these are the kinds of, they sound detailed and tedious. But, you know, all of this was about the details. Testing, do you close a school, do you open a school, can you target on the block level? It's always about the details. It's always about the details. And government normally is not good at details.
Governor, one thing we do know is that President Trump will be in office at least until January 20th. What confidence do you have that you'll get the kind of guidance you say you need?
Look, am I confident about the competence of this federal administration or the substance of this federal administration? No. I mean, I think I've made that abundantly clear. But you do the best you can in every situation. I think what the NGA is doing and the governors as a collective are doing is right and smart. We're learning the lessons from the first chapter. Answer the questions before we begin this journey. Let's all be clear about what we're talking about and what we have to accomplish and who does what. And where is the handoff? And how is it going to work? And then we'll see. I hope the White House learns from the first chapter. I haven't seen any evidence that they've fundamentally changed their disposition, right? This is a president who still won't say wear a mask after every scientific expert tells him to tell people to wear a mask. This is a president who was a super spreader himself at the White House, at the Rose Garden event, right? So, no, I don't have a high level of confidence, but we do the best with what we can.
When do you expect to hear something with regards to this, and what's the next step if they don't answer those 36 questions?
We have a draft plan that we're working on, but as we said, the draft plan is all based on very sketchy information. So I'm sure once we get the questions answered, then we can come up with a real plan. The governors have posed the questions directly to the White House. This did not happen in the first chapter of COVID, right? It was an iterative process in the first chapter. It was just sort of evolving. Here, the governors have framed the issue very tightly because the governors now know it's going to turn to them, right? They know how this story works because they've gone through it. It's not going to be that the federal government says, don't worry, we're going to administer it, right? Chance of that happening is zero, nada, niente. The federal government is going to wind up saying, it's up to you, the states, right? We learned that lesson. So the governors are saying, before you get to the shift of responsibility, we need to know, have these questions answered. And again, the National Governors Association is not a political organization. There are Democratic governors, there are Republican governors, and these questions are not political questions. They are questions that anyone would ask. A high school student who was posed with this challenge, design a program to administer vaccines, would ask the same questions, right?
On a different topic, you talk about first chapter, and part of that first chapter, we had COVID deaths in nursing homes. So right now we have a demonstration in Cobble Hill where they would like more transparency, they say, they would like an apology, and assurances that in the future, in a second wave, it would be different. Any reaction to that?
If they want assurance, well, people died all across this country and in this state. People died in nursing homes because the virus preys on the old and the weak. We know that. The virus was introduced in this country, in the state of Washington, in a nursing home. Everyone, I believe, did everything they could to save lives, and New Yorkers were heroic, specifically in nursing homes. We still have the most aggressive safety program in nursing homes in the country. We test every nursing home worker once a week. What happened in nursing homes was the virus got into nursing homes from staff who had the infection, and at a time when nobody knew it, before we had any testing capacity, and frankly, back when this country was saying you have to be symptomatic. So nursing home workers who were not symptomatic, they went to work. The only ones who we advised not to go to work were symptomatic, because that's what the federal government said. You can only, it's your sneezing, your coughing, etc. If you're not sneezing, if you're not coughing, if you're not symptomatic, they told us you couldn't spread. That's how it got into the nursing homes. Also may have gotten into nursing homes early on by family visitation on the same theory. The nation was told only symptomatic people can spread it. So family members who were not symptomatic went to nursing homes to visit. That was before we knew better. Then, weeks later, we learned, no, asymptomatic can spread, etc. Then we developed more testing later on, so then we can actually test nursing home workers, etc. So, but can anybody say, would we be better prepared for a second wave? Yes, all across the board. We've learned a lot. But can anyone say if another virus that targets the weak and the seniors, that you can keep them 100% safe? Nobody can say that. And if they say that to you, they're lying. Unless you took a nursing home and put it in a hermetically sealed bubble, no staff going in and out, no delivery people, no plumbers, no electricians, no supplies coming in, you can't stop the virus from spreading once it's in the American home, right? Once it got inside these borders, you cannot hermetically seal any area. Even with our most aggressive program in the country, test every worker once a week. Nobody else does that. Yeah, you could be tested once a week. You could still get the virus in between those two tests, and you could still bring it in. You know, there is no perfect system. But would we do everything we could to protect every life? Yes. You want to add anything, Melissa?
No, I would just add to that on the governor's point. We're struggling right now with the nursing home in Steuben County. We've had outbreaks with the nursing home. Up in the North Country, there was a nursing home death in Westchester over the weekend. So even all these months later, even with the mandated testing once a week of all the staff, even with the 14-day, you have to have no cases in a nursing home for 14 days visitation, and obviously there's a lot of family that are upset or frustrated with that policy because they miss their loved ones, and understandably so. Even with everything we've learned, it still remains an enormous challenge, and one that we take very, very seriously. And then you look around the country, as of this morning, 6,455 deaths in nursing homes in Florida. You know, you look in New Jersey, over 7,200 nursing home deaths. You look in Massachusetts, it's over 6,300 nursing home deaths. This is not a unique New York challenge, but we have taken the lessons that we learned in the spring while we were struggling to ramp up and apply them to the fall to do everything we can to protect our most vulnerable.
It was a political argument when advanced by this federal administration, advanced by political operatives at Health and Human Services. Because early on, COVID was primarily in Democratic states when it started. And early on, their response was, this is a Democratic state problem. It's a Democratic governor problem because the Democratic governors are in charge. And by the way, look at how many people are dying in nursing homes. They started that, which I think was cruel and mean, because people who lost a person in a nursing home now have to hear, well, maybe their life could have been saved if government did something different. The administration stopped saying that. You know why? Because now the other states, Republican states, red states, are seeing the numbers go up. And today, they're losing a disproportionate number in nursing homes. Today. Not 7 months ago. Today. After 7 months, they're still losing a disproportionate number in nursing homes. So, the administration has stopped saying that, right? Melissa's point, go look at the numbers in Florida. How are you losing so many people in nursing homes? They're going to surpass us, certainly. 7 months later, after you learned all the lessons. Now you have the tests. Now you know that people asymptomatic spread is possible. You have all this information now. And by the way, you have all these drugs that you didn't have back then. The mortality rate, I believe, I haven't looked at the numbers, there are more drugs to deal with this virus than there were 7 months ago. We didn't have the Regeneron therapeutics, you know. So how is it still happening that you're losing people disproportionately in nursing homes all across the country? They won't raise the political argument anymore because the truth is you'll never solve that problem totally. They are old people with compromised immune systems, and they are most vulnerable to the virus.
Governor, the Borough Park community activists are planning to protest against you and your policies tomorrow because of the cancellation of this large wedding. What is your response to that?
Yeah.
Do you plan to have law enforcement there if there's large crowds?
Yeah, look, I understand their point. They had planned a large wedding, and everybody was excited for the large wedding, and then the government says, you can't have this large wedding. How terrible. We were all excited about the large wedding. I get it. On the wedding itself, you can't have a wedding now with thousands of people. There is no safe way to do that. We know that. We know that that a party with 100 people has generated issues. A bar with 75 people has generated issues, right? You're going to have a wedding with thousands of people? But I understand that they wanted to have a wedding with thousands of people. Yeah, I understand that. I understand there were college graduates who didn't get to graduate college this year, my daughter among them. I understand there are people who lost loved ones in nursing homes. I understand there are people who lost loved ones in a hospital bed and couldn't even go see them while they were in the hospital. There's been a lot of personal loss and a lot of personal sacrifice. And I understand we're tired, COVID fatigue, we're tired of the sacrifice. But that is something we do as a community and as a collective and as a social responsibility to one another. That is the only way we stop the virus. The only way we stop the virus is by a collective. And if one person in the collective wants to have a wedding with thousands of people, that's going to endanger you, and you, and you, and you, and you. We say we have to have some rules for the collective, and we'll all sacrifice a little bit.
Well, what about the protest? If they do a
Look,
large protest with thousands of people?
They have protested a day without a protest. I'm trying to think, when was the last day I've had without a protest? A day without a protest is like a day without sunshine. Look, people are unhappy about the rules. I get it. And there are many people who are unhappy. I'm unhappy. I think we're all unhappy. On the issues to be concerned about, I can't go to work. I closed my business. I can't go see a loved one in the hospital. My child hasn't gone to school, and I'm afraid is going to fall behind. I haven't been able to see my mother and my father because they're elderly, and I'm afraid to see them. I really wanted to have a wedding with 1,000 people. You know, on the scale, I think I really wanted to have a big wedding isn't at the top of the concerns. I couldn't go to church. I couldn't go to synagogue. I couldn't go to work. I couldn't go to the hospital to see my loved one. My child can't go to school. I think those protests, I get 100%. I also get, I wanted to have a big wedding. I get it. My suggestion, have a small wedding this year. Next year, have a big wedding. Invite me. I'd come. Thank you very much, guys.